The country on Friday saw a record number of new cases in one day. To sort through the latest developments, we're joined once again by our medical expert. Dr. Arnold Baskies is joining us live. Good morning, Dr. Baskies. Dr. Baskies.
Good morning, Lauren.
Dr. Baskies is past chairman of the National Board of Directors of the American Cancer Society and chair of the Global Cancer Control Advisory Council. Dr. Baskies, the White House is putting pressure on schools to reopen this fall. The Philadelphia School District is working out plans to resume classroom learning, and the CDC put a school reopening plan out this week. This is something that concerns so many families in our area. So what do we know about how safe it really is for students to return to school buildings?
Well, Lauren, the American Academy of Pediatrics has produced a set of principles for opening schools. I would recommend that the viewers visit that website. For a safe reopening, this will be very, very challenging. There are so many issues that need to be addressed. Can it be done? Yes. Will it be different? Yes. Will it be easy? No. But the big question really is it really doable? What would make sense is a hybrid model where there is some in-person and some online learning to avoid crowding. Classroom size is extremely important. Strict attention to hygiene and cleaning of bathrooms and high-touch areas like light switches on a frequent basis. All those things need to be attended to. The kids and the teachers need to practice respiratory etiquette. Masks will be necessary, and individual supplies need to be used and avoid sharing equipment. Ventilation is also really key. So there's a lot of challenges ahead. And finally, there needs to be a basic understanding that if the student is ill, that student gets checked before attending school, not after.
All right, a lot of things for parents to keep in mind. Let's put some of this data into perspective for folks. Pennsylvania hit its highest number of new coronavirus cases since May. So how are you interpreting that? What are we seeing here? Is it a surge? Is it too soon to say? How do you view the numbers that we're seeing from our area?
Right. So what we're really are dealing with is semantics. We need to avoid talking about surges and concentrate on data and what we know that are facts. Here's what we do know. Pennsylvania reopened on May 8th. On that date, the viral transmission rate was low. 14 days later, on May 22nd, the viral transmission rate began to rise. A viral transmission rate above 1.0 is what is the problem. We want to keep that viral transmission rate below a number that's called the viral transmission rate, which is 1.0. It implies if it's above 1.0 that the virus is spreading. New Jersey's viral transmission rate hit an astoundingly low figure on April 26th and has been rising steadily. The highest viral transmission rate, believe it or not, is in Delaware at the moment, and it's steadily risen to over 1.2. So the viral transmission rate is what we need to focus on, and that's what the problem is. It's going up in Pennsylvania, it's staying steady, but tending to rise in New Jersey, and it is very high in Delaware. Can we get back to a low viral transmission rate if we follow some very basic and simple rules? Yes. Social distance, wear a mask, wash your hands. Definitely we can do that. We can succeed in limiting the rate of spread of this virus. For the viewers who are interested, if they want to become amateur epidemiologists, go to this website, rt.live, and you can see what the viral transmission rate is in every single state. They're going up except in five. It's going up except in 5 states. So we need to be very cautious and take the precautions that we know work.
And we want to talk to you a little bit about, as we're getting new information in about treatments for coronavirus, we're getting new information about the effectiveness of the coronavirus drug Remdesivir. Tell us about what does this latest study show and what might this mean going forward?
The news about this antiviral drug Remdesivir keeps getting better and better. As you may remember, this is a repurposed drug. It was initially employed for Ebola and hepatitis C years ago, but wasn't effective. But it was taken off the shelf, literally, tested for COVID, and it is effective. The study that you're talking about this week was from researchers at Vanderbilt and at the University of North Carolina at Chapel Hill. They reported that Remdesivir potently inhibited the virus in the laboratory. This is big news because we now have laboratory confirmation that Remdesivir works. In addition to the COVID virus, There are other studies in those same labs that have shown that remdesivir is effective against a vast array of other coronaviruses, including other bat viruses in China. There's a tremendous search going on for other compounds which are designed specifically to stop the virus. Remdesivir wasn't designed specifically for this virus. For full disclosure, I happen to be on the board of directors of a biotech in California, which is currently rapidly searching for active compounds against this virus. The goal is to create a designer drug that is more active against this virus than remdesivir is. That would be the key to stopping the virus, having an effective treatment together with effective vaccines.
Dr. Baskies, one of the questions about coronavirus is what happens after a patient has it, and then they have these antibodies in their system, but how long does that protect you, and what do we know about that? There's a new study of Spain's population that shows COVID-19 antibodies are insufficient to provide herd immunity. What should we make of this?
Right. So there are a couple of issues here. One is that we know from other coronaviruses like MERS, there's a study that was done years ago that looked at how long the antibodies lasted. And in MERS, they lasted for months, but then started to taper off. The key isn't, however, how long the antibodies last. It's whether or not your immune system has been challenged to the point that it can react to a new challenge. And that's one of the things we don't know. Herd immunity is a concept that translates to this. If the virus has hit over 60% of a population, the transmission rate of the virus stops or drops, and then it becomes less of a threat. The problem is that it takes time for a large population to have 60% of its population infected. And as the virus hits more and more people, there's collateral damage. So this is a very frequently asked question. The key is to get antibodies right away and then hopefully have them last. But the real test of the vaccine will be if it prevents other infections later on by essentially challenging the immune system so that it can give you an effective treatment or an effective response if you get re-challenged. That's what we don't know about the current vaccines. But the information that we have right now is that the vaccines have been creating a very good level of neutralizing antibodies. And I think that's what we need to focus on is the good news here, that the vaccine trials are underway, that we have a number of them. There are 140 vaccine trials, with 17 of them already in human beings. The ones that have been frequently reported, like the ones from Cambridge, Massachusetts, the ones from England, have all shown that we get really good antibody responses. So that's really what we really need to be focused on. There's lots of reasons to be hopeful and cautiously optimistic as far as I'm concerned.
All right. Thanks, Dr. Baskies. Always appreciate your perspective.